the movements that we'll do for the lumbar and spine.
Lumbar, thoracic spine, flexion, extension.
All right, can you stand? Okay, and so facing that way, just back up a little. So what I'm going to have you do is, can I just have you can support yourself at the hips, and if you want, slowly start to actively bend your spine as far as you can. Okay. So here I can stand off on the side, I can observe, see the flexion of the spine, right? Any pain? So now this is active extension, going back. You can have them demonstrate hyperextension. So can you continue bending back, all right? Any pain? All right, good.
Rotation and lateral flexion.
So for rotation, I'll stand in the front. I'll ask them to hold their arms out to the side like this. And can I have you turn that, right? So what I want to do is make sure that as they rotate, they're not horizontally adducting, right? So sometimes people will turn and go like this, and it makes it harder. So making sure that they keep their arms in the same position, observe the rotation of the spine, okay?
Cervical spine flexion.
Hold on. Lateral flexion, so arms out to the side, right? And so now bending to one side, going back to neutral, and then bending to the other side. So you can demonstrate the action for them or talk them through it.
Okay. Cervical spine flexion and extension.
Okay, cervical spine. I'll say, can you bring your chin to your chest? So as they actively flex the cervical spine, I stand off on the side and I observe. Okay, go back to starting position. And now, so that's moving into extension back to the starting position, and then they can extend by bringing your nose up towards the ceiling. Okay, any pain? So hyperextension. Okay.
Rotation.
Rotation. Look forward, and then can I have you turn to the right? Okay, back to neutral. Turn to the left. So these active rotation. Observe to see. Are they making compensatory movements? So is somebody going like this when they rotate? Is somebody rotating and then that's happening? Is somebody rotating and then that's happening? So these will always reveal disharmonies with some of the muscles, okay? Lateral flexion, will be right ear to right shoulder. All right. Now, what did he just do?
He lifted his shoulder up.
Compensatory move, busted. No, so you want to observe. Another thing that you'll see sometimes is this, right? So they'll laterally flex their spine in order to allow some of these movements to take place. So yeah, just observe. And sometimes if they're not able to do it, you can even, is it okay if, so you'll even go this and then say, bring your right ear to your right shoulder. There you go. Always ask with active range of motion, is there any pain? And always chart if there's any limited range of motion or pain dysfunction. Okay?
Shoulder flexion.
For shoulder flexion, again, if I'm going to evaluate this, I'm going to stand off to the side. I'll ask the patient to raise their shoulder all the way up, all the way up. Okay. You want them all the way up. Now, back down to the starting position, and can you bring that straight back? Okay, extension. Now, for abduction, have them start in anatomical position. So here, the palms are forward. Now, can you raise the arm all the way up? Okay, good. Now, can you bring that arm all the way down, starting position, then bring it across? All right, good. Now, you can also have them test posterior adduction. So can you extend that arm, bring it back a little bit, and now bring it across. There you go. So posterior adduction as well.
Horizontal abduction.
Horizontal abduction, their palms are going to be forward, 90 degrees of abduction, and then bring an arm straight across. This is horizontal, well, one at a time. Otherwise that happens. So bringing it straight across and then bringing it back. When you bring it back, this is horizontal abduction back to zero, the starting point. If you're moving beyond that, it's a different combined movement. Because now it's horizontal abduction, but it's a different joint and it's retraction and scapulothoracic movement, right?
Horizontal abduction, adduction.
Yep, we did those. Okay. Internal and external rotation. So if you start in this 90-90 position, right? 90 degrees of elbow flexion, 90 degrees of shoulder abduction, then have them do this. Okay, any pain? Right, so a little limitation in the range of motion, back to normal, and then up like this. So again, things to look for would be, you know, do they have to compensate? Sometimes holding like this and going like this, the patient is going to drop the arm, or the patient may shift or do other stuff. So just observe the ranges of motion, check if there's pain.
Protraction and retraction.
Okay, so protraction, you can ask them, you can stand here, you can ask them to move their shoulders forward like this. This is protraction, or they can reach forward with their hands. You know, don't stand in front of them and have them throw a punch. This is just, none of this is working, Fab. None of it. You guys, some Jolt Cola. Retraction is going to be the opposite. Think about bringing the scapula together. So protraction, they're moving the scapula apart, right? Retraction, they bring the shoulder blades together. Okay?
Elevation and depression.
Elevation and depression, shrug the shoulders up. Any pain? Back to neutral. And then active depression, pulling them down. Oh, it feels so weird. No? Doesn't bother you?
Maybe you get some TOS going on.
Maybe I have some 45 years old going on. All right.
Ready. Elbow, forearm, wrist, and hand. Flexion and extension of the elbow.
Elbows, forearm, wrist, and hand. Flexion and extension. So in anatomical position, again, you can have them flex the elbow, extend the elbow.
You have a progression that elbow is first.
Yeah. Elbow, right? Then forearm. So pronation and supination. They can bring their arms out like this. Thumbs up. This is the neutral position. Pronation. Back to neutral. Supination. Okay? The wrist. Again, anatomical position just makes it easy. But it can be demonstrated in other positions. You're not going to get it wrong if you do it in another position. But watch. Here, we have flexion of the wrists. Okay? We have extension of the wrists. And it could be like this, like this. It can be with the elbows bent, all right? But then, ulnar deviation, radial deviation. If you do this, radial deviation, ulnar deviation, it's still correct as long as you demonstrate the correct movement. But remember, once we start pronating and supinating, especially if you're taking a test, you know, and just test pressure, stress, anxiety, you know, it's very easy to get confused. So sometimes the best thing to do is always just go back to anatomical position, right? This makes it a lot easier. Or remember, memorize radial side, thumb side, ulnar, pinky side, right?
Flexion and extension of the digits.
Yeah, so for the practical test, you're not going to have to do any of the movements of the digits, right? But again, depending on the joint that you're talking about, flexion is going to be this, or this, or this, right? The movements of the thumb are not going to be isolated on the test either, so we'll move past that. Extension, we're not doing extension of the forelateral or of the thumb. I don't isolate the phalanges at all. So, you know, you need to know it for the written portion, but I don't want people like, you know, going like this and you know, yeah. It only took once for I literally saw somebody like taking the test and go, "Ooh, I know this," and like grabbed the finger and was like, "This is extension," and the person was like screaming and yeah.
It's
no one, everyone goes home safe.